I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebowitz, Long Island Gynecomastia Center. It's Tuesday now, mid-May, and we've got two cases today, both being filmed. Actually, a whole week of surgery, and a special surprise at the end of the week, which you'll see. But anyway, we got gynecomastia. This young man, he's in his mid-20s. He's local. You're local, right?
Yeah.
You're from here, yeah. He's local. He's a big guy, 200 and some odd pounds. Lost a little weight there. Got some stretch marks going on here. But he's concerned about his chest. And again, when I do an extended gynecomastia. So I want to go down to this line here. Sorry, my hands may be cold. All the way over here. Get this gland out, melt it. He's got some gland here, but we'll see how big it is once I make the cut. Stealth incisions, armpit, by the nipples, obviously on both sides, and one right there to etch the midline here and to get the upper six-pack. 1, 2, 3, 4, 5, and 6. He's really got to work on that. Go down to the lats in the back, create this beautiful negative space here. It's all about negative spaces, positive spaces, light. I should one day start to do some injections of the fat up in the up here, but I don't know if people want, like, would you ever want like fat to be injected up here?
I mean, if I don't have a chest, then yeah.
Yeah, but you do.
Yeah.
Yeah,
I wouldn't like it.
Yeah. See, if you make a muscle. He's got pretty good there. It's kind of just this stuff. There you go. Can you do it one side, this side? No, there you go. So we're gonna do the Vaser Hi-Definition Lipo. Get out the glands. Do J plasma, of course. We got to do J plasma when we do the lipo. That really tightens up nice, and adds the finishing touch on it. We're going to rock and roll. Okay, so I marked him, and let me explain my markings here. This is kind of a roadmap of what I'm going to do. Some doctors just do kind of like circles where it's most and they go around, but mine's more, definition and where I want to keep things and where I don't want to keep things. So the deltopectoral groove over here, the midline going down, I'll give them a nice, you see those the separation of the muscle right up here, and the 6-pack, 4-pack, 1, 2, 3, 4. Going to empty all the space, this hatch mark here, empty that really down, kind of a transition zone over here to leave some volume here and don't touch anything up here. This little rhomboid shape here is kind of nice and give us the male cleavage right in the center, so the nice separation of the pectoralis major muscle. Empty this space nice. The first 6-pack is more of a curved, and then the second one is bigger, and the third one goes down here, which we're not going to touch. Because if I do the third one, then I got to go way down here and around, and that's a different operation. Again, empty everything. The lateral edge of the pectoralis major muscle, the inferior edge, this semilunar line, semilunaris, right here, I want to really indent that nice and carry that all the way lateral. So indent this nice and carry that all the way lateral. Empty this space particularly and leave some volume where the 6-pack is. So I'm going to numb them a little bit in my little areas right here. 1, 2, 3, 4, 5, and then we'll go to the OR. All right. We pump you up.
Pump you up.
All right, so this is Vaser. We got it all set. We're beautiful. We numbed him. He's happy. He's relaxed. He's nervous. He's excited. right, now we either stick in the eye with this, or we suck you out.
Suck you out.
So what I'm doing now, guys, I'm emptying. I mean, he's not a big guy, but I'm emptying the space, you know. See this nice semilunar line right here. I'm gonna sculpt the muscles a little bit, empty this a little bit more, but I want this nice space there. So I took out his glands, I lipoed him, and now, you know, this is part of what I do. So I'm etching his, I've already etched the bottom and the top. But I'm gonna go over that again. This is my curved cannula. Throw the first switch. Throw the second switch. Throw the third switch.
Not the third switch.
Throw it, I tell you, throw it.
Okay. Oh man.
It's alive! It's alive! It's alive!
So if you have gynecomastia surgery, make sure your doctor throws the third switch. See, not the third switch.
Not the third switch.
No, do it with.
Oh,
Come on, bend over a little bit, like you have a hump. See, master, not the third switch.
Master, not the third switch.
So Dr. Lebowitz, Long Island Gynecomastia Center. Great case on this gentleman. He was already fit, had just glands, and just wanted to perfect his body. So that's what I did. I got out 2 liters of fat from him. These are the glands. The right side was this one, the left side a tad bigger. He's gonna do my gland in hand. And what I reviewed what I did. My stealth incisions, one here, one here, one here, one here, and finally one there. Did the deltopectoral groove, went down. You can see this great negative shape. He's still swollen. I used almost 4 liters of fluid for him, but these are the lats back here, negative space here, the lateral and inferior aspect of the pectoralis major muscle. Went on down here, the semilunar line over here, and then the upper 6-pack, linea alba right there, and the 6-pack 1, 2, 3, 4, 5, 6 we didn't do. But this is my extended gynecomastia surgery. So he's going to look amazing. He's going to work out, fit, maybe lose 20 pounds possibly to get the belly better, and I guarantee my results. So gynecomastia, Dr. Lebowitz, please don't ever go to somebody who'll just do regular lipo or take out the glands, because with me it's really torso, chest, and torso sculpting, because I do include the upper abdomen, the shoulders, deltoids, the lats, and of course the chest with my work. Come to me, or at least call me and call the other guys, and you'll come to me. Right?
Yes.
Yes, sir. It was a good experience?
Great experience.
You had fun?
I had a lot of fun.
Good, good. See, he had fun and he looks good at the same time. So, Dr. Lebowitz, 631-424-0101, 631-424-0101. Thanks and see you soon.
Wow. We can now work this out, right?
Yeah, and that's after it's been whittled down.
Wow.
Kind of fibro-fatty.
Yeah. So this is fats right here, the yellow.
That's mostly fat just stuck underneath the gland.
Underneath the
I mean, I even use a special like basket cannula to really get it out.
Yeah.
It got clogged. It just was clogging. So that you just have to cut out. That's the little one.
That was on the right
That's the little one.
side.